So I'm LB, and I am the project manager for Vital's Every Step. And we are a statewide initiative focused on improving maternal behavioral health outcomes across Alabama. And we're hopeful to decrease the numbers in maternal and infant mortality. And we're wanting to do that through utilizing SBIRT. If if anyone has heard of SBIRT or familiar with SBIRT, drop it in the chat. Just curious to see. It stands for Screening, Brief Intervention, and Referral to Treatment to identify and address substance use, depression, and domestic violence among individuals who are pregnant or attempting to become pregnant. We're partners with the Alabama Department of Mental Health and the Alabama Department of Public Health, and we will work alongside OBGYNs, community health workers, and a growing range of organizations across the state to ensure that pregnant and postpartum individuals receive the support they need for positive health outcomes for both moms and babies and communities. And I have my contact information. If you are also working towards reducing those mortality rates, let me know. You can scan that QR code and get in touch. Let's get connected. And or if you're interested in learning more about Esper and your organization, let's get connected. I'd love to talk more with you about it. And then you can also visit our website. And so today's session is a wonderful complement to that mission. I'm so excited for you to hear from our speaker. And before I introduce Maya, we have a couple of housekeeping. You can, so all the virtual attendees, all of you here, you'll be muted and your cameras will remain off throughout the session. If you have any questions for our speaker, please use the Q&A box. I'll be collecting those throughout the presentation and then bringing those back up at the end during our Q&A session. And then also, of course, as you think of some, you can also drop it in there towards the end too. If you experience any technical issues during the session, please put a message in the chat box to Vital, or you can contact Empress at ecwright@ua.edu. We also have the information in the chat. All right, so I'm so excited to introduce our third presenter for this series today, Miss Maya McDaniel Bailey, LPC. She's a licensed professional counselor, doctoral candidate in the counselor education and supervision at the University in counselor education and supervision at the University of Alabama, and the founder of From Rain to Rainbow Counseling and Consulting. Her work focuses on trauma-informed care, emotional regulation, and mental health support for parents and caregivers. Maya teaches graduate level counseling courses and facilitates continuing education trainings on topics including burnout prevention, compassion fatigue, ethical care, and trauma responsive practice. She has clinical experience working with complex trauma, substance use, eating disorders, and mood disorders across residential, recovery, and university counseling settings. In addition to her clinical and teaching work, Maya serves as Director of Development and Guest Educator for Motherhood Supported, where she helps develop community-based programs supporting postpartum mothers and NICU families. Her work centers on creating accessible, trauma-informed systems of care that support both families and helping professionals. So without further delay, I'm so excited to hear from you, Maya. Let me stop sharing my screen and you should be able to take it away. And you are muted. I don't know if you're. I know there's a
Oops,
always.
sorry about that. Yeah,
You're
so
good.
thank you. Let me share my screen as well. Thank you guys for being here. I'm so excited to spend this time with you guys. I will say that this work comes from not just a, professional, but also a personal kind of, I guess, mission of mine. The reason why I am focused on maternal mental health is because of my own experiences with perinatal mood disorders and just how bizarre the perinatal period is, and even with like being a licensed counselor, it felt really disorienting and felt really overwhelming, and so that kind of ignited my passion to get more informed about how to support mothers, how to support families throughout the perinatal period so that we can help support our community, because that's the backbone, of just making sure our that we break cycles essentially. So, and yeah, and most of my research that I'm focused on is supporting NICU families and helping to make sure that those families feel supported and embraced in a time that's really complicated. And today, we only have an hour, and there's a lot to cover when it comes to trauma-informed care specifically. But we're going to do our best to, talk about everything that I feel like is within our power individually as clinicians. We'll get to some of that. But before we dive into the presentation, I want to hear a little bit about who we have in the room in terms of, oh, there's some echoes. Are you still hearing the echo?
Sounds good on my end.
Okay. All right. Yeah. So who do we have in terms of clinicians? Like, do we have mental health counselors? Do we have OBGYNs? Like what, I would love to hear who we have in the room. And even if you want to put in the chat, like what interests you in this type of presentation. Yeah, case manager. Yeah, that's counselors. Amazing. Welcome. Care manager, social worker. Yes, awesome. Awesome, awesome. Yes. Lactation consultant, amazing. NICU parents, yes. Um, Group practice, mental health therapist, awesome. Yeah, yeah. So it sounds like we have a wide range um, of practitioners here, and I'm really excited that you guys are all here and interested in learning more about this topic. So. Yeah, keep dropping them down. And I don't know if we already talked about this, but we'll have more questions at the end. But feel free to, enter questions like as we go along, and I'll try my best to address them. But we'll kind of have a specific time at the end for questions as well. So yeah, let's go to the next slide. So, like trauma-informed care. So it begins with you. And when I talk about trauma-informed care, I want to make space for the fact that it is hard as a clinician to, provide trauma-informed care in a system that doesn't always reflect that that infrastructure or that system, So it we really need a regulated nervous system to be able to provide trauma-informed care, to be able to kind of hold space and to be able to be present and to be able to have that benefit of the doubt. We'll talk a little bit more about that. But I just want to validate that the working conditions that healthcare professionals are under, it isn't the most conducive to providing trauma-informed care. And I want to say that because I want to normalize the fact that a lot of us want to be trauma-informed and provide that care while we're also holding that we're constantly burning out, running on fumes. And that makes it really difficult. I can definitely share the PowerPoint afterwards. Good question. So yeah, so kind of points here. Working in healthcare exposes clinicians to urgency, suffering, uncertainty, repeated emotional demands, right? It can erode a clinician's spirit, I don't know if I'm on the Instagram that has like lots of psychotherapy memes, and there's that one going on around where you're on your knife session of the day, and like you're kind of talking gibberish almost, but like you're still holding space. You want to be there, you want to do everything you can. But like I said, I want to normalize that a lot of recommendations that I'm talking about in this presentation, a lot of the things that we need to do to kind of create a trauma-informed environment can feel impossible in some of the work environments that we are in. So, and recognizing the cumulative, secondary trauma that we experience, there's a lot of compassion fatigue, like I said, burnout, and there's a lot of research to support that the chronic stress that healthcare workers, especially, experience it changes the function of the brain. It enlarges the amygdala so that we kind of stay in that fight or flight and that safety, that survival zone where we're not able to apply some of these practices that are very important. So when it comes to trauma-informed care, I like to also talk about, like as we said in my bio, I really am passionate about burnout prevention as well, and making sure clinicians are doing their own work. So we're going to talk a lot about that. So, but my biggest point here is evidence-based trauma-informed implementation includes supervision, peer support, staff training, practices that support workforce resilience. It's about the whole infrastructure. It's not just on the individual. So it a lot of us get into the healthcare world field because we want to help people, we want to save the world, and it can feel really overwhelming when it feels like you're in a system that doesn't support that mission, right? So I want to normalize that for all of us as we go into this because it can feel really daunting to say like, okay, um, uh, how can we implement this? How is this going to be realistic? So I'm hoping to kind of break things, the trauma-informed care principles down into things that we can actually implement that you guys can leave today and start thinking about changes that you can make. So, biggest takeaway, like as we go into this presentation, is knowing that a care environment can't be psychologically safe for families, for mothers, for the babies if it's chronically unsafe for clinicians. So, at every level, we want to make sure that we are advocating for safe and supportive working conditions for healthcare workers as well. So we're going to go to our next slide and talk about our objectives. So what are we going to talk about today? So we're going to talk about the prevalence and clinical impact of the perinatal mood, anxiety, and trauma-related disorders, including the influence on adverse child experiences and prior trauma. We're going to explain core principles of trauma-informed care and apply them in the perinatal clinical practice and in healthcare environments. Want to identify signs and symptoms of trauma-related distress, including postpartum PTSD symptoms, emotional dysregulation, dissociation, and attachment disruptions. And then talk a little bit about evidence-based, scope-appropriate interventions, including psychotherapy, referral pathways, attachment-focused strategies, mindfulness, informed regulation, and other things that you can actually do to add to your toolkit to make sure you get some support. So, all right. So, why is trauma-informed care so important, especially in the perinatal period? So, first, we're going to talk about just the prevalence of mental illness in general throughout the perinatal period. So, according to a recent review, even antenatal depression, the prevalence is about 65%. So, and the review by obstetrician and gynecological review, the journal talks a lot about all of the recommendations, a thorough review of really the state of maternal mental health. And like I said, it's the prevalence of antenatal depression even is up at 65%. And that's significant, right? That's like two-thirds of mothers who are experiencing depression at very high levels. Um, and we can think about like the contributing factors to that. You know, pregnancy in general, it brings on so many expectations, so much fear of the unknown. And the biggest thing that I want to talk about is the comparison, right? Like from the movies that we watched growing up to really social media, thinking about like getting your photo shoots together for Instagram, all those types of things. There's so much pressure from like, even if we're not talking about trauma history and all these other extenuating circumstances that can compound the pressure of the maternal period. Just thinking about how we're constantly thinking about how we're perceived, how we're constantly there's constantly this box that we're put in, and how being a mother, like it just seems like there's no right answer, right? Like either you're working and you feel like, oh, should I be more, should I be with my kids more? Or you're with your kids more, you feel like, should I prioritize my career? It just kind of, there's that saying of you're expected to work like you don't have kids and parent like you don't have a job a lot of times. And like I said, within that spectrum, it just feels like a lose-lose a lot of times because again, we're kind of crushed by the weight of expectation, and we're constantly comparing our insides to other people's outsides. So, like I said, that prevalence of 65% is staggering and is based on, you know, thorough reviews of what it looks like presently, like what the state of mental health is for moms. And like I said, societal pressures of, you know, bouncing back after you have a baby. Like there's, and like I said, I've experience with eating disorder treatment as well. Thinking of body image, thinking about your body changing. It's a perfect storm, the perinatal period to bring up um, so many old demons, you know. Approximately 1 in 5 women experience a mental health condition during the perinatal period in general, and untreated perinatal mental health conditions can impair social and personal functioning, reduce a parent's ability to care for themselves and their family, and contribute to a poorer long-term child outcome. So, there's another, and let me know if you guys want like a list of references because I feel like being in a PhD program, I feel like I'm constantly reading all these articles and would love to share all of them. But there was recently a actually in Germany, they compared adverse childhood experiences and tracked uh, how likely it is to break the cycle of adverse childhood experiences, which we'll dig into a little bit more. And the biggest predictor to breaking the cycle of the prevalence of adverse childhood experiences was based on the maternal mental health of the family and socioeconomic status. So the way that mothers are cared for, it not only impacts the mother, but it impacts the family, it impacts the children, it impacts society as a whole. So like I said, like this is why this is important. And I'm sure you've probably heard this in other presentations, but around 80% of pregnancy-related deaths are preventable, with about around 23 to 27% being mental health related. And that is regarding either substance use or suicide. So um, I always like to say there is a maternal mental health crisis going on right now. And like I said, it just feels like a lose-lose situation for a lot of moms in that are creating families and wanting to, break the cycles that maybe they felt they were stuck in. And there's so many factors outside of their control. And the reason I want to talk about this is whether you're a lactation consultant, OBGYN, social worker, case manager, like all of the different, professions that we listed in the chat, um, that is an opportunity to remember that it's a chance to help people not fall through the cracks, a chance to help that individual know that they're not alone and help empower them. And knowing just how pervasive or how helpless people are feeling right now, how helpless mothers are feeling right now, I think is important for us to remember that we have an opportunity to partner with that person to help them feel seen in a time where they feel alone and powerless a lot of times. So. All right, so next, like I said, so pregnancy can also be a trigger for past traumas, and when it comes to adverse childhood experiences, so I know I mentioned that before, but just to define what that looks like, that can be neglect. It can be that's emotional or physical, sexual abuse, physical abuse, but also, well, when adverse childhood experiences were established, actually was normed on high income white men. And so, and they showed there was a wide prevalence of adverse childhood experiences. And like I said, or if parents were divorced or was instability in the home, there was abuse between parents or just instability. And since then, they're actually expanded the definition of adverse childhood experiences to also include societal experiences of low income experiences, like not having enough to eat, also systemic racism, and in addition of violent actions that happen not just in the home but outside the home too. And we can put that into context of what children are experiencing right now, and really how what our society is experiencing right now of constantly being bombarded with not only the traumas that are happening in our homes, but also in our communities and in our world. So I say that because a lot of the data on adverse childhood experiences, you can see that continuing to expand because there's almost a sense of like an ambient trauma that we're constantly experiencing when it comes to the news cycle or social media feeds, where it constantly dings at us of we're experiencing all of these terrifying things. And um, even think about childhood experiences of school shootings, whether they actually experience that or not, just that fear constantly of going to school. And what if that happens if they just heard of something happening in another school district or on the news? I want to say this because like I said, 64% of Americans have at least one adverse childhood experience, and six or more adverse childhood experiences have been shown to cut down life expectancy by as much as 20 years. And why does that happen? Because the impact of chronic stress, with that many adverse childhood experiences, uh, it can impact one's ability to take care of themselves physically. Sometimes there's more heart disease, sometimes lung cancer. There's a lot of physiological and emotional negative impacts that come along with that. And then obviously there's an association with lower socioeconomic status. So like think about access to healthcare and preventative medicine that could be accessed. So why I bring this up is that we're not just treating the client in front of us, we're also wanting to make space for the fact that there is a myriad of experiences that they've had before then that are weighing on their psyche. And not necessarily that they might not even be thinking about it, but that their body is aware of. You know, a really great book to read is The Body Keeps a Score, that talks about how our bodies hold all of these negative experiences that we've had, how our nervous system reacts to that. Um, where like if you're in like a really intense car accident or have experienced physical or emotional abuse, you may not even cognitively think about it, but your body will kind of look for cues of those experiences and an attempt to protect, you know. And like I said, prior trauma can shape how a person experiences like exams, like medical exams that you experience, just touch, tone of voice, pain, loss of control, medical uncertainty, and even early caregiving. Thinking about, I feel like a big thing is kind of rumination over like the toxic patterns that a mother may have experienced, whether it be like emotional distance or neglect or sexual trauma or really uh, those feelings of powerlessness and helplessness. Once the baby comes into the world, or like once they find out they're pregnant, it could become this obsession of like, how do I break the cycle? What do I do? And thinking about that so much can cause a barrier to the mom actually taking care of themselves because it becomes this extra weight on them. So like I said, um, pregnancy and motherhood in general creates this perfect storm, creates this hotbed of triggers for these adverse childhood experiences or other traumatic events that an individual, that the mother may have experienced throughout their lifetime. And it's important for us to make space for that, to know that whatever client comes in front of us, to kind of normalize that it is likely that they may have at least one adverse childhood experience that could be sitting in the room with us, yeah, as well. All right, so and then birth trauma. Birth trauma is something that can also come up. So physically, think about the harm or injuries that could be sustained by the birthing person or the baby that could happen during that period, and can. You know, there's lacerations that can happen. There are so many medical complications that can happen afterwards. And then the newborn can have so many different injuries, and then go to the NICU, which is life-saving and so wonderful to be able to have that opportunity to save the infant's life, but also that immediate separation from the mother, and also thoughts of feeling like my body failed me, you know, my body, like what's wrong with me, kind of all these negative internalized beliefs that a mother may have already, the physical and emotional impacts of birth can bring that back up. So, talked about emotional distress that results from negative or distressing delivery experience, and it can lead to postpartum depression, severe anxiety, and postpartum like PTSD. Um, and like I said, becoming a mother is full of so many unknowns, so many expectations, so many feelings of helplessness, you know, and there's so much information out there. That yes, of course, like you can watch a YouTube video or go on social media and get connected, but a lot of times it's hard to, like I said, it's kind of drinking out of or it is kind of like drinking out of a water hose, but that there's so much information, so many resources that especially if you have a prior history with trauma, your system can feel so flooded and so overwhelmed that you don't even know where to start. You can feel helpless, you can feel paralyzed. And so, for us as clinicians, it's important for us to recognize that what is often painted to be as this fairy tale or this experience is that is sunshine and rainbows, which I'm sure if you're in this training that there's a reality to it, but uh, it's so even though we know because of our training and even if you personally experienced it that um, giving birth and becoming a mother is life-changing and can turn your life upside down and can be really distressing. The What's portrayed on media and what's portrayed or the expectation or that people have in their heads doesn't actually match reality. So having knowledge about the specific triggers that individuals can experience throughout this process can help us to be more informed and be more prepared to hold space for that and be ready to to be a resource for our clients and our patients. All right, so what does trauma-informed care even look like? So, like I said, we're gonna do a bird's eye view of what this looks like and kind of break it down to both individuals, like what we can do personally, what we can do in our care teams, what we can do as a system, and kind of leave with some specific actions that we can take to support our support mothers. So, what is trauma-informed care? So, trauma-informed care is a universal approach to care delivery, and it assumes trauma may be present. It promotes safety, trust, choice, collaboration, empowerment, and cultural responsiveness. It can be practiced by all helping professionals within scope. When we talk about trauma-informed care, we're not talking about being like PTSD treatment, which is clinical treatment for a specific diagnosis or symptom or pattern, which could include like EMDR, lifespan integration, all of these evidence-based practices that are focused on, settling the nervous system and like integrating the trauma, and it can include trauma-focused psychotherapy, specialized referral, requires training, consents to stabilization and scope-appropriate practice, and not every distressed parent needs trauma processing, right? So I want to kind of make this clear that trauma-informed care isn't about really it's not about what you do, it's more about like who you are, how you show up in work every single day, with the assumption that everyone that you encounter has gone through something. Yeah, and you don't have to understand it, you don't have to agree with where they're coming from, but you can hold space and say like, hey, I'm going to validate that um, you have your own story, and I can separate that from my own experiences, my own judgments, my own stories that may distort our ability to show up and be there for whatever that client needs or that patient needs. So. Okay, so let's talk about it. So, according to SAMHSA, which is the Substance Abuse Mental Health Systems Administration, and trauma-informed care basics, it's safety, peer support, trustworthiness and transparency, collaboration and mutuality, empowerment, voice and choice. Like these are the basics, like completely taken from the website that we're supposed to prioritize when it comes to trauma-informed care. So safety, we want to make sure that clinics, that our participants, that our patients, that our clients feel physically and psychologically safe. Physically, you just want to make sure that there's no physical threats, obviously, but psychologically safe. That's something that we may not have like full control over because like if they have a trauma history, then they're constantly perceiving threats. They're constantly looking for or really expecting a lack of safety because that's what um, their normal was. Like the second that they kind of let their guard down was the second that something terrible happened. So they have their guard up all the time. And so when it comes to psychological safety, we'll talk a little bit more about that. I want to focus on what is our nervous system doing? Like how can we model, regulation and a sense of um, a sense of I like to say equanimity, which is that kind of like picturing a tree firmly rooted into the ground where storms come, rain comes, wind comes, but like we still know our roots and we know um, that no matter what weather happens in this, if it's sunny or if it's raining, that we're the sky, we're the constant. And that can be really hard for individuals with the history of trauma. And when it comes to us as clinicians, we need to recognize our own stuff too, because what can be triggers for the clients can also be triggers for us too. And if our nervous system is dysregulated, then it creates a opportunity for like we feed off of each other. So our activated nervous system can contribute to their activated nervous system as well. So and then peer support and mutual self-help are key vehicles for establishing safety and hope, building trust, enhancing collaboration, and utilizing lived experience to promote recovery and healing. Um, an antidote to a lot of shame that comes up, a lot of those negative beliefs that often arise from a trauma history is compassion, empathy, and being able to normalize that it's not like there's nothing wrong with you. And a big thing to keep in mind is instead of like picturing what happened to you or what's wrong with you, to kind of picture what happened to you instead. We don't want to reiterate or kind of reinforce the beliefs that people are broken. We want to reinforce the belief that people are, I like to say, glorious unfinished works of art. Where everything that happened to them is kind of adding to the masterpiece that is their life. And again, that they may not feel that way in the moment, but our job is to kind of help instill a little bit of hope. Help kind of tilt the scales a little bit towards compassion and away from judgment. Trustworthiness and transparency. We want to make sure that there is so much clear communication, right, when possible. Right? We want to be direct. We want to build trust, and we want to make sure that um, again, like if you think of a trauma history, if a person kind of went home every single day and didn't know what to expect. Maybe their parents were there, maybe they weren't. Maybe they'd be able to eat that day, maybe they wouldn't. Maybe there was violence there, maybe there wasn't. They're on high alert. So the like being transparent, being like communicating proactively, and not hiding anything, kind of building uh, that trusting relationship is important in trauma-informed care. Collaboration and mutuality. Importance is placed on partnering and leveling power differences between staff and service participants. A lot of times, with the medical industrial complex, it's about like, I'm the expert and you're broken and I'm here to fix you. What we want to do is work as a team instead. And of course, as counselors, a lot of mental health professionals, that's what we're trained to do anyway, is to kind of walk with our clients. But as if you go into the medical profession, a lot of times, the medical professionals know how to diagnose and how to treat a lot of conditions. And so it's expected, like, I have something wrong with me, help me fix it. But we also want to normalize that, individuals know their bodies, they know what they're experiencing as well. And so being able to kind of empower them to be able to talk about what's going on. So why this is important, again, with a trauma history, a lot of individuals end up downplaying, minimizing, kind of talking themselves out of having any issue because a lot of times they figure like, why should I even acknowledge what I'm going through? Because no one's going to take care of me anyway. No one's going to pay attention. So they just start ignoring until it's hard for them to even perceive or communicate what's going on anyway, to self advocate. And then kind of leads perfectly into empowerment, voice, and choice. Want to make sure that people are empowered, that we want to make sure that people are like feel encouraged to be able to use their voice, to have a sense of autonomy, to have a sense of knowing that their voice matters. So many times, again, kind of having a trauma history and And systemically, like in society, a lot of people feel like their voices have never been heard. And again, kind of going back into like how many times do I need to uh, is a person going to advocate for themselves um, and ask for what they need and be ignored and then expected to keep asking for what they need? Some people, they kind of keep pushing and they're like, I'm constantly going to ask for what I need and keep advocating. But some people that just chips away at their sense of self, it chips away at their hope, at their um, like they already have like a small flickering flame and that can put it out. So when it comes to trauma-informed care, if we kind of make space for the fact that a lot of people's voices felt erased, like a lot of people felt erased essentially, then we can take a step back and see like, okay, how can I help this person realize that their voice is important and that I don't know their needs unless they communicate them and try to kind of create a space that helps them um, feel like, or kind of build evidence that it is possible that when you use your voice that you're going to be listened to. All right. So levels of trauma-informed care. What does this actually look like? So on the individual level, what this looks like is communication, offering choice whenever possible. Is it okay if I sit here? You know, uh, do you want to sit or stand? Like, do you want the door open or closed? Like, there's just so many different things that you can do to just offer a choice instead of just assuming, like, if you can find opportunities. Um, and we want to make sure we're screening, just like LB talked about earlier. Screening is so important. Assessment is so important, especially if we're assessing everybody, then no one feels singled out, right? And we want to validate, educate, and encourage. A lot of the research, especially in the NICU, shows that just being able to be educated and kind of understanding what to expect, understanding what's normal and what's abnormal, can help people to feel a little bit more empowered, feel less helpless, because think about when it comes to walking into this experience where there's so much unknown, we want to make sure that and that moms especially feel like, hey, um, this doesn't discount you, this experience. This is actually something that is, you know, um, is your body trying to adapt, kind of helping them understand that in some ways, even though it feels counterintuitive, that your body is kind of trying to work with you, not against you, when it comes to like the emotional responses that you may be having, when it comes to what the system is doing. Like, there's a lot of like family-centered care that is being starting to be implemented in neonatal intensive care units where parents are more involved. Like when it comes to rounds, when it comes to staffing, when it comes to communicating what's happening with the baby, the parents are actually involved and more involved in caring for the individual to kind of help people feel less helpless, help them know that they're not left out, help them know what is actually going on so that they don't feel like they are like an imposition on what's happening, or that they don't feel like they are an outsider, or just that they don't feel um, like they are kind of uh, disconnected from the process, right? And postpartum, when a mom already feels kind of dissociated, already feels like her body isn't her own because there's so many changes. Her stomach's all squishy, like because their uterus is huge and not the baby is gone and like outside of her body, and just like there's so much adjustment to happen. So the more we can educate the mom on what's going on and help them feel a little bit less helpless, the better. And then validation. Validation is so important because I think it's important to remember that you don't have to agree with someone to validate. So if they say like I'm a terrible mom, you don't want to say you're a terrible mom, but you can validate like this is all new. This is overwhelming, and I can understand why you'd be questioning yourself right now. And, last part of that is encouraged to be able to say, you're still showing up, you're here, like to make sure that when we're encouraging and we're holding space for individuals, know that our brains can register lies, saying, or toxic positivity isn't helpful. Like saying like, at least this is going on, or at least that is going on, or at least this and this and this, that can make people feel even more discouraged and a deeper hole. It's not about what it looks like, it's about the function. One of my favorite affirmations is you're an instrument, not an ornament. It's not about looking shiny and pretty and like Instagram ready. It's about you know, tuning your instrument, hydrating, um, uh, uh, recognizing worth outside of, what feels comfortable or what looks productive. Yeah. So, and then lastly, individually, self-care practices are the biggest part of trauma-informed care because if we're not doing our own work, recognizing our own triggers, recognizing how our own adverse childhood experiences shape the way that we navigate clinically, then it can be pretty easy to re-traumatize individuals, because a lot of times, especially as helpers, when we're under stress, we dig deeper into helping, into accommodating, into people pleasing, and that will burn us out, and then we feel checked out, and then the client, the mom will come in, and this is yet another person that doesn't care, and obviously we do care. We're here, we're showing up, pushing ourselves beyond our limits because we care so much. But the impact of that is um, you kind of end up being like a shell of yourself, a ghost of yourself, and not able to kind of be as present as you want to be. So that's why I say individually, self-care practices are the most important part of this. And then clinical team. So the unit level, like making sure there's warm handouts, there's consistent communication before exams and procedures. There's debriefing after traumatic births, codes, losses, NICU transfers, lots of communication. There's peer support, reflective supervision, staff check-ins. It's not just about the individual or not just about the patient. It's making sure that the team, the clinical team, is taken care of too, and that that everyone's working together. The lactation consultants, the caseworkers, the therapists, the OBs, that we're all communicating with each other so that so there's not as many gaps, in the system, and that especially that the mom isn't being told one thing and then another, and that there's because the more confusion in an already helpless situation will just again kind of make people shut down, make the traumatized individual shut down more. So program wise, I want to make sure there's universal screening, of course, and referral pathways. Screening itself is one thing, but without actual action or like warm handoffs to actual care, like it's not as consequential, So, and then education groups and peer support is important. And then system organizational level, like we want to make sure that systems are providing training, trauma-informed care, implicit bias, de-escalation, all those types of things for clinicians. And that there's balance so that again that the clinicians that the professionals can actually take care of themselves so that they can take care of the moms in these systems. All right. And again, ACOG also has these recommendations of this is a little bit short, more of a shorthand of realize the widespread effect of trauma and understand paths towards recovery, recognize the signs and symptoms of trauma, respond fully, integrating knowledge about trauma into policies and practices, resist policies and practices that re-traumatize, calm yourself to help model and promote calmness for the patient, contain the level of detail, maybe don't be as graphic in your descriptions, just be mindful when you're communicating, be have care and compassion for patients and yourself, and then modeling coping skills, like having them on deck, having, we'll talk about the resources, we'll go there, that you can offer, there's deep breathing. There are also some studies that show singing can be really helpful. Humming itself, like whether you're like you feel like you're a good singer or not, just being able to hum, being able to sing activates your vagus nerve and it resets the nervous system. So, kind of modeling like, what's your favorite song? Let's sing together. Or like, what's the song we can sing with baby? Or like, incorporating any kind of creative practice like that, that can help the nervous system feel a sense of calm can be so helpful. And, again, just kind of modeling some coping skills that are realistic in the moment that they can utilize. Okay. So here's some more information. I highly recommend watching the TED Talk Anatomy of Trust for Brene Brown. I know we're getting close on time, so I want to make sure that we have a discussion too. But um, that TED Talk is really helpful in being able to recognize what helps and hurts trust. And the biggest thing that we want to make sure that we do is, like again, have boundaries, be reliable, take accountability. A lot of these things are something that we do already. But I highly recommend watching that TED Talk. I can send you that as well. But biggest thing is non-judgment, generosity, integrity, vault. All these things come together to help us um, create safety, not just for our clients, but for ourselves as well, so that we kind of build self-trust. And when it comes to accountability, just know you're never going to be a perfect clinician, right? And in our culture, accountability looks like shame and judgment, but real accountability is just, like Brene Brown says, clear as kind, being transparent, being honest, being direct, and knowing that it's an opportunity to repair. And a lot of times, a lot of people don't have the experience of people actually taking accountability, like admitting when they're wrong. So it can be a really curative experience. So, like I said, definitely recommend watching that TED Talk, The Anatomy of Trust, and just because it helps to kind of establish that foundation for building trust and knowing what to address if you miss the mark. So again, there's no trauma-informed care without self-care. So we need to make sure that we're understanding our own adverse childhood experiences, our own nervous system, our own triggers, our own warning signs that we are operating with a um, at a deficit so that we can do our own work to kind of implement some care, with some grounding, some deep breathing, some meditation, taking reflective pauses, making sure a big one of my favorite things is halt. Hungry, angry, lonely, tired. Do a quick check-in. Do I need something to eat? Do I need to take some deep breaths to kind of regulate anger? Especially feeling helpless. Anger can come up a lot in our practice because again, like we there's a lot that we can't do, and taking a deep breath and remembering our agency can help with that. If you're feeling lonely, feeling isolated, because a lot of times we give so much that we don't have left for ourselves. And so taking a time to kind of show up for ourselves and be present for ourselves and remember, kind of nurturing that self relationship too. And then tired. If you're exhausted, obviously there's not a lot of things you can do in the moment. But again, taking 5 minutes to, or even 60 seconds to do some deep breathing practices, or even just validating like, hey, I'm exhausted right now, and figuring out, or making a commitment to yourself that like, hey, I'm going to do something for myself so I'm not like doom scrolling at night so that to make up for the fact that I feel depleted and feel ignored, and then making sure we're asking for help, making sure we're talking to each other, talking to our leadership, knowing that other people don't know what we need unless we tell them again. So we just need to make sure, like, and again, also want to make space for a lot of times we kind of stop asking for help because we feel like no one's going to listen anyway. But like I'll go to in terms of resources, Postpartum Support International has these consultation groups that we can use. We can like on Facebook, there's a lot of really good groups, and if there's not one, we can start our own. Be willing to reach out for help and be able to talk about what's going on so that you don't again, because it is about sustainability here and it's about being ethical in terms of being a helper as well. But again, it's not solved. Burnout isn't solved individually. Systemically, we need changes. If you're in leadership, just making sure that you're prioritizing opportunities for peer support, for training, for regulation time, to help, know that that's going to create safety for our patients too and clients. All right. And then co-regulation, just know that there's so much support to show that like my nervous system and your nervous system are constantly talking to each other. So as clinicians, we need to make sure that we have some kind of practice to help reset our nervous system so that our nervous system isn't uh, setting off more alarm bells for our patients. All right, so what does it look like? So my favorite way to describe what like the impacts of trauma is the window of tolerance, right? So when this is a way to kind of display it, like when we are in a window of tolerance, we can feel rational, mindful, calm, grounded, present, stable, relaxed, and oftentimes when stress happens or when trauma happens and then we experience triggers, that window narrows into a point where we just kind of pop back between this hyperarousal state where there's high energy, anxiety, anger, overwhelm, hypervigilance, chaos, fear, panic, frustration, or hyperarousal where there's low energy, shutdown, feeling passive, feeling withdrawn, having shame, hopelessness, feeling detached. And a lot of times in that, really from the time you get pregnant all the way until like it's about 2 years after giving birth, and it can even extend longer depending on symptoms. The mom will kind of bounce in between this red and green zone where she's either disconnected, that the person's disconnected, or full of rage, anger, anxiety. And so here's some screening tools that we can use, but again, screening, it's not just about screening, it's about the treatment too. So we're going to kind of move on in the interest of time because I want to have some talks about this too. To see like, okay, we recognize it, like what are some things that we can do both individually as clinicians to kind of take care of our nervous systems and also kind of resources to give our clients. So, but also when I talk about postpartum PTSD, some symptoms that you may see are intrusive memories, nightmares, flashbacks, psychological reactivity, avoidance of reminders, appointments, not going to appointments, not even looking at photos, feelings of shame, guilt, blame, detachment, feeling of failure, irritability, panic, sleep disruption, like spacing out, losing time. I don't know if you guys have experienced, but I've had many times, like even me postpartum of like just not even being able to kind of put timelines together mentally. That can happen to them, and just like not really remembering everything, And I feel like I see that a lot on social media too, of like people saying like I can't remember. Feeling like you can't remember anything, but you can remember the last time they ate, like all these specific all this specific information, but also feeling like your brain is just a fog, And then again, that feeling of flat affect, not caring, and extremely like having emotional distance, and a lot of times that can lead to feelings of like, why am I even here? Like feelings of not questioning their purpose, not knowing that of course, every child needs their mom, and but in that state, a lot of times the brain can say like, okay, well, they're probably better off without me. And so that's when we need to really make sure they're getting support. Um, Again, let's see. All right, so treatment. Again, psychoeducation is so important, and a lot of times, Postpartum Support International, I feel like, is the such a great resource that offers education, offers peer support, offers like all for free, and offers a directory of clinicians that are trained in perinatal mental health support that they can link up to. But again, we just want to make sure that people feel validated, kind of make sure that they have information and make sure that they feel like, encouraged, um, with realistic, like kind of help remind them of the evidence that they are not their situation in that moment. And when it comes to warm handoffs, if there is obviously endorsement of, suicidality, we want to make sure we get them to a hospital as soon as possible. And a lot of times that could be really difficult. When they're like, I don't want to be away from my baby, but in the long term, we want to make sure that people stay safe. And so, how do we do that in a trauma-informed manner? Again, it's about choice, it's about communication, about working together. So, when we're creating a safety plan, there is 988, there is all of these resources. So let's kind of work together with the client to find a plan that works for them, and that fits in, that kind of prioritizes the urgency of the situation, but also kind of is a conversation, not just kind of barking orders at them, if that makes sense. So. All right, so let's talk about some resources. Again, we're getting close on time, but so evidence supported foundations or psychoeducation, grounding, mindfulness informed awareness, sleep support. One big thing that's a lot in the research is kangaroo care, just that skin to skin contact, holding the baby. There's some music assisted, kangaroo care that can be really helpful too. Whether it's like playing music out loud or again, that humming, that singing can be really restorative for the nervous system as well. And also reading can be really helpful in this time to again, kind of engage other senses, like get them out of their head and into their body, into the world, so that they remember that they're not stuck in that cage, stuck in the past. There's about we we're going to go to this next one so that we can talk about that. So that's why I like to talk about creativity. And again, I feel like we don't have a lot of time to talk about all the things that we need to talk about, but we usually only use about like 5% of our brain when we're just kind of stuck in the cognitive part. And when we tap into art, that opens up the 95% of our experience that we can access with music, art, rhythm. During pregnancy and postpartum, like I said, singing, activating that vagus nerve, just humming, taking some deep breaths and humming. It actually kind of helps with kind of teaching your brain that you can vary your heart rate, so that deep breathing and the again, kind of igniting that vagus nerve, it creates this feeling of agency, that we didn't have before. Yes. And then, so music engagement, singing, listening to music, humming, lullabies, dancing. There's this thing called conscious dance where it's basically improv dancing, but it can be really helpful to kind of again getting out of the mind and in the head, and you can kind of like moms can kind of hold their baby and just kind of move to the music and again get out of their head. There's feelings of freedom and freedom of expression, feelings of like it's not about like performance, it's about embodiment, it's about being connected. All right. We're gonna go to our resources here. So, Postpartum Support International, like I said, there's free support groups, and there's actually an app that you can tell your clients about to connect to, where they can instantly like be connected, or they can schedule support groups, but they can be connected to CLC Mama, which is a non-crisis line where they can talk to a professional at any time, so that there doesn't have to be space in between when they're feeling that discomfort and when they're getting help. Selfcompassion.org is a great resource to kind of help decrease shame by increasing a sense of mindfulness, calm humanity, and self-kindness in that order to help remember that we want to turn towards ourselves and suffering instead of away. And here's some other apps. So the Finch app is like this little self-care app that we can that they can have that can they can take care of it and kind of makes them kind of do some coping skills like journaling and like walking and like all those types of things to kind of take care of themselves in between. And there's How We Feel app to kind of help with emotional intelligence, like kind of recognizing your emotions, some mindfulness activities in there too. And then the I Am app is a an affirmation app that can be really helpful. So sorry, I feel like we have so much that we talked to. I know we don't have much time, but I do want to open it up to just any questions or just any kind of brainstorm any ways that you feel like you can implement or like I guess my biggest question is like where do you feel like you see the gaps are? And I'm very open to kind of feedback or ways that we can communicate about ways to shift the culture in your current work environment to be more trauma informed. And again, when I talk about trauma informed care, we want to talk about what we can control. A lot of times that is our own nervous systems and what we do and how we show up. And remembering that um, we can't show up for our clients if we're not taking care of ourselves, so I'm going to go, and I know we don't have that much time, but I did want to say that if you have any questions, feel free to email me as well. We can kind of talk through this more. But again, trauma-informed encounter is about showing up with compassion and about knowing that being ready for your nervous systems to have conversations with each other and kind of modeling that the more you treat yourself in a way that says you matter, the more the client's gonna know that like, hey, I matter, we can't. Oh, Maya Angelou has actually a really good quote about this of like, it's hard to like, I don't, she says, I don't trust people who say I love you and don't love themselves, and quotes a African proverb that says, be wary of the naked man offering you a shirt, you know. So making sure that we are um, prioritizing that self-love because it's something that we're with all the time, and that it shows up in the room whether we want it to or not, or whether we're aware of it or not. Yeah. So so thank you guys for being here. And again, I know we had lots of information and just kind of a really brief overview of what trauma-informed care is. And I'll send over this presentation, like if you guys want access to it, or like feel free to reach out. Currently, I'm really working with working with institutions to kind of incorporate trauma-informed care into their system. So feel free to reach out if you want some more assistance with that, some more communications about that, for more thorough trainings, so that we can change the system. You know, it starts with each and every one of us to remember that we all go through something and we all deserve to feel loved, you know, to feel compassion, to feel respected during this process. So thank you guys.